This is Mrs. Palmer-Quay with the second video for Unit 13 on the respiratory system. In this video, I will be talking about some common ailments and disorders of the respiratory system. Before I get into specifics, I'd like to talk about a few terms. The first one is apnea, which is a suspension of ventilation or a stoppage of breathing. You may have heard of sleep apnea, which is when someone stops breathing during the sleep cycle. This is only for a very short period of time, of a few seconds. My father has sleep apnea, and so I'm very familiar with this condition. He snores quite heavily, and we would camp. As a child, I was involved in camping with my family in tents and in pop-up campers, very close proximity to my father when he was sleeping. So I have many memories of listening to him snore at night, and then there would be silence when he wouldn't be breathing, and then he would start again with a tremendous intake of air and a big snort. If sleep apnea is severe enough, people will wear a mask that forcibly puts air into their lungs and keeps them breathing. Then we have dyspnea, which is the shortness of breath, or this feeling of not getting enough air in. And this is a common condition or a symptom for emphysema, which we'll talk about later, or any of these conditions that there's loss of lung function. Then someone would be said to be suffering from dyspnea. Hypoventilation is when there's not enough ventilation, not strong enough breathing rate to get the carbon dioxide out of the blood. And so the person is suffering from an increase in carbon dioxide and a decrease in the amount of oxygen, or hypoxia. A common disorder that is caused by or is related to hypoventilation is obesity hypoventilation syndrome, which is a condition which occurs because someone has so many extra pads of fat surrounding the thoracic cavity that it's very difficult to fully inflate the lungs, and so they're never taking enough air in because they're sort of breathing shallowly all the time. And lastly is hyperventilation, which is breathing too rapidly or more than normal. And this leads to a decrease in the carbon dioxide levels in the blood, which indirectly then ends up leading to a narrowing of blood vessels going to the brain, which then can cause you to become faint, faint-headed, dizziness, and may actually lose consciousness. Hypoventilation often can be part of anxiety or panic attacks, emotional stress, or I know that for myself, during childbirth, during labor, I had a tendency to hyperventilate that's why they have you take those breathing exercises when you have children and want to have them without medication. So going on to some common ailments, these aren't included in the learning targets, but since we're very familiar with things that go wrong in our respiratory system, at least sort of minor immune challenges, I thought I would go over this. So I'm going to just talk briefly about colds, the flu, sinus infections, bronchitis, laryngitis, strep throat, pneumonia, and then allergic rhinitis. So a cold and the flu are very similar in their symptoms. They both have general nasal congestion, a runny nose, sore throat, possibly a headache. The flu, though, is more severe in that it usually has a high fever. Sometimes you have a fever with a cold, but it's not a high fever. And then you also experience muscle pain and joint pain as well in the flu. And then in severe cases, especially with children, they may also be suffering gastric discomfort as well. So both of these are caused by a virus, and if you remember from our immune system discussions, viruses move into cells. They hijack the protein synthesis part of cells, and so this is an infection into cells caused by a virus, and then you have to get those immune system T cells to destroy them. Both the cold and the flu tend to last 7 to 10 days, and this graph just gives you a good picture of that on how the symptoms will decrease over time. We've got some few days that things start getting worse, and then your immune system starts working, and overall you get a pretty rapid recovery. The only exception to that is this purple line, which is, as you see, is a cough. Coughs can linger for quite a while after you've had the cold or the flu. Moving on now to sinus infections. A sinus infection or sinusitis often follows a cold, but they are not necessarily caused by the same virus as the cold is. A more common path to having a sinus infection is that your sinuses have lost their drainage path. It has become blocked because of the inflammation of the mucous membranes. And so the environment then, which was set up to be constantly collecting pathogens coming in from the outside air and trapping bacteria and trapping viruses and trapping particles in the mucus on the inside of those membranes in your sinuses, just like all of your upper respiratory system is designed to do, well, it can no longer send those bits of dirty mucus down the pharynx, so it can be swallowed and the pathogens can be digested by your stomach. And so the bacteria remain in the sinuses, and they remain in this nice, high-protein, moist mucus that is just a prime breeding ground for bacteria. So that it's more a case of that the drainage has been turned off that ends up having you have a sinus infection as an indirect result of the cold, and not that the cold has directly caused you to have a sinus infection. So it's basically because those sinuses are such a nice place for the bacteria to grow that you can end up having sinusitis. This, of course, would be treated by an antibiotic since it's a bacterial origin. Then we have bronchitis, which again may follow a cold because it can be viral, but it also can be a bacterially caused infection. And in bronchitis, your bronchial tubes become inflamed. And so the primary symptom here is coughing, because if you remember, sneezing is when you have irritation to the upper respiratory tract, and coughing is when you have irritation to the lower, the trachea or the bronchial tubes. Often with bronchitis, you've got a thickened mucus layer that you're coughing up as a response to the inflammation. There's two kinds of bronchitis: acute bronchitis that comes on in response to a viral or bacterial infection. Once your body has thrown it off, it goes away. And then there's chronic bronchitis where you are coughing for months, and it's often related to a lung disorder and not just an infection. And we have laryngitis. That tends to be common after a cold. People end up losing their voice, but you also can lose your voice because you have overworked your vocal cords. So the vocal cords have become inflamed. It can be because of an infection, but it also can be because of overuse or some irritation. You've been exposed to smoke from a campfire or something else that would cause the tissues to become inflamed. So the sound is distorted, sometimes to the point that you can't really get any sound out at all because the cords can't vibrate. So this illustration here just tries to show you in a pictorial form what it would look like if all the tissues around your larynx are inflamed and those vocal cords then can't send the vibrations through the air when you want to speak. Strep throat is a bacterial infection, and this picture down here shows you what you can see. You can see these colonies of bacteria that then have been attacked by white blood cells, and we've got some pus forming, and just, it's looking like an infection, and that's what it is right there on the palatine tonsils in the back of this person's mouth. A strep throat is a pretty serious situation. It's a sore throat that's usually accompanied by a fever, sometimes a rash, and you can often see these white patches on the back of the throat. It can cause complications because the bacteria can travel, and so you can end up with bacteria taking up residence and making colonies in kidneys or into the heart, which then, because of rheumatic fever being the case when they've moved into the heart, you can actually have damage to the heart valves. And so strep throat is something that's not to be messed around with. You have to have a culture of the bacteria to verify that it is the right diagnosis. And so there's now an instant strep test, but it used to be that you had to wait, and the more reliable strep test is one that takes a couple days because they're actually growing the bacteria that's taken off the back of your throat, growing it in a culture to then be able to do further tests on the colonies of cells. Pneumonia is another infection. It's an infection now down in the alveoli, usually a bacterial, though there are viral forms. And so, as you might expect, you've got a cough because it's right in your alveoli. You might often have chest pain, fever, you generally have that with infections. And of course, difficulty breathing because you've got an infection down there blocking air passages. So the diagram over here on the right tries to give you an idea of what happens. The normal alveoli on the top you can see there's lots of space, but when they are filled down below with all of the remnants of an infection, so you just think of a skin infection, of what the pus and all of the extra fluid, and of course you've got blood vessels all throughout here that if anything gets nicked or open, you might have a little bit of bleeding into the alveoli or into the alveolar sac here. So in pneumonia, you've got parts of the lung that are being filled up with stuff where you can't have breathing happen. And it will show up on an x-ray. I have a little x-ray here on the left showing how the lung, which normally would be clear, is showing this cloudiness. And so pneumonia, is usually fairly treatable, especially if you're elderly. It can be much more serious, but if it's a bacterial infection, then you can have an antibiotic. Viral, you just got to treat the symptoms and let your body fight it off. And then we get down to allergic rhinitis, which is generally called allergies. I have allergies, I sneeze, or hay fever. And it's due, as we've talked with our immune system video, it's due to a hypersensitivity of the immune system. Your body reacting to a piece of pollen like it's a major pathogen and bringing out the troops and, sending all of the immune response. So primarily you're getting a response of histamines being released by mast cells, and histamines then make the capillaries leaky, bring fluid to that part of the body, and so that leads you to a runny nose, and inflammation can lead to itchiness, which gives you the itchy eyes and the itchy throat, all the stuff that are just common symptoms for allergic rhinitis. Again, with this, you treat it with an antihistamine to try to calm down the immune system. So now let's get into some respiratory disorders. There are quite a few, but I'm only going to focus on 4 main ones: asthma, tuberculosis, chronic obstructive pulmonary disease, or COPD, and then lung cancer. So in asthma, your bronchial airways are chronically inflamed, and then there are times where there's a spasm that happens in response to certain triggers, which vary from person to person. An asthma attack may be triggered by a certain allergy, an allergen coming into the body, or by an infection in the body, or some kind of irritant that's not necessarily an allergen. So there's 3 steps or 3 parts to an asthma episode. You have the bronchial lining swelling, you've got a tightening of those smooth muscles that surround the bronchioles, and an increased secretion of mucus, so that you end up really closing off the airways. This leads to that characteristic wheezing sound that happens when somebody is having an asthma episode, not being able to get enough air through because the passage is so small, and what air does move through, then it has sort of a whistling and wheezy sound. And it can be life-threatening, so that asthma can be quite a serious condition. Sometimes people have more serious episodes when they are younger, and then they seem to moderate a little bit when they are older. But overall, we're finding that asthma rates are rising in this country, and there's several hypotheses as to what might be going on. It may be related to just the amount of airborne irritants that we're all exposed to through pollution and various other chemicals that are just out there in the air. But a very interesting diagnosis, I think, is this thing called the hygiene hypothesis, that says because we are so concerned about cleanliness, we don't, in a sense, we don't give our immune system enough to do, and so it tends to overreact then. They've done some studies about children that were raised with pets and traced, their incidence of asthma and several other autoimmune diseases later on in life, and found a correlation between, a lower rate of these disorders and a greater exposure to just kind of animals or pets, all of the dirt that's part of life. So I'm not too worried about raising my kids on the farm here. I think probably it's giving their immune system lots to do, and nobody in my family has asthma, so I think there might be something to consider with this, that there might be some benefit to just constantly challenging your immune system with small pathogens to kind of keep it focused on what it really needs to be thinking about. So here's a little diagram just to show you graphically how asthma works. And so we've got our inflamed bronchial tube over here. You can see there's just not much space for air to flow through, and so the person is going to be feeling that discomfort, that dyspnea of not getting enough air in because they won't be able to get enough air in. Tuberculosis is not so much a problem in the United States. Only about 5 to 15% of the United States population has been exposed to tuberculosis, but in many Asian and African countries, more than 80% of the population does have this, they register positive to an exposure to tuberculosis bacteria. And so when it's active, it's a slowly progressive pneumonia. It's an infection in the lungs primarily. Almost all tuberculosis cases are lung tissue based. It can occasionally develop an infection in another part of the body, but basically it pretty much is in the lungs. And so the symptoms not logically would be a chronic cough with some blood in the mucus that's coughed up, fever, and weight loss. Tuberculosis used to be called consumption. If you read any books that are set in the 1800s, you might hear about somebody dying of consumption, and they were dying of tuberculosis. You can treat it with antibiotics, but it's a difficult process. Several different antibiotics need to be used, and because this is such a ubiquitous disease, the antibiotic-resistant bacteria are increasing in number. It's just can be quite a problem in other parts of the world, and there's been some concern about rates surging again in the United States. What's difficult with tuberculosis is that there is a latent period after someone has been infected, and so that they may be carrying the tuberculosis bacteria around in their body for years before they have an active tuberculosis infection going on. Here's a diagram that's just showing what tuberculosis can do. It just will put holes in your lungs because it's making cavities, breaking down the tissues. The infection, the bacteria is colonizing right there on the cells in your alveoli, producing toxins and killing those cells and creating holes in the lungs. Now, I did not proofread this slide well enough. When I started it, I saw that I have my letters rearranged. This is supposed to be chronic obstructive pulmonary disorder, COPD. I'm going to talk about next. I got my letters in the wrong order. But this is a progressive disease in which the airways and the alveoli lose their elasticity, so that you can imagine that this means that getting air out of the lungs, exhaling, would become more difficult because we depend on that elasticity, that rebound of the tissue, to increase the pressure inside the lungs and to force the air out. The walls of the alveoli are destroyed as part of COPD. Bronchial linings are chronically inflamed, and increased mucus secretion clogs the airways. So there's really two different forms of chronic obstructive pulmonary disorder, and it's rare that somebody only has one version or the other. But we have emphysema and chronic bronchitis as kind of these two ways that things will go wrong. So these first two symptoms are related to emphysema, and the last two are related more directly to chronic bronchitis. So in emphysema, the walls between the alveoli are damaged, and to the point that they disappear, they break down. And so the surface area decreases in the alveoli, and so that means that gas exchange is also reduced. Smoking is the leading cause for emphysema, including secondhand smoke, which is why it's such a big deal about avoiding secondhand smoke if you can. Even if you don't smoke, you can suffer from having exposure to it. But any airborne pollutant can also be involved in causing emphysema. Shortness of breath is obviously a very common first symptom, and there may also be a cough. And so we've got a normal lung here on the left. This is just like a photograph of a lung, looking at the lung tissue on a gross standpoint, not a microscopic standpoint, but macroscopically. And so you can see, even macroscopically, you can see how the tissues have broken down between the alveoli, and you've lost the surface area that's supposed to be there for gas exchange. It's just become big holes in the lungs. In chronic bronchitis, well, it's bronchitis, as we talked about earlier with acute bronchitis, but it's chronic. It's always there. And so that the linings of the airways are constantly inflamed. Because of that, this constant inflammation and the response by the body to a state of constant inflammations, that the lining eventually thickens, and the mucus secretions also grow quite thick. And so you've got not much space there in the airways, and you're getting it clogged up with this mucus that's very hard to move out. There's a chronic cough that's continually coughing up mucus, but despite that, there's still, the inability to get enough of it out so that someone can feel like they can breathe freely. So there's shortness of breath to the point of wheezing like you would see in asthma. Again, smoking is the primary cause, but other airborne irritants can be involved. And if these irritants are not removed, if a person does not stop smoking and so forth, the disease is progressive, and so it just gets worse and worse. So this diagram is just talking, showing you a comparison of pure emphysema and pure chronic bronchitis, but in reality, for someone who has COPD, that you have both of these at work. But in the case of the emphysema, it's working at the alveoli, and in the case of bronchitis, it's actually the bronchial tubes that are affected. You put the two of those together and you can see why you're in trouble. Then moving on finally to lung cancer. We have two main types of lung cancer. There is small cell lung cancer, which is the most aggressive. It is the one that's very metastasizes very quickly, and it's got a strong correlation to smoking. Smoking seems, pretty causative effect. You smoke, and you're likely, if you get a cancer, it'll be small cell. And then there's non-small cell cancer, and these small cell and non-small cell are either looking at the cells under the microscope and making this distinction. And there's several different types of non-small cell cancer, and this is actually the bulk of the types of lung cancer. And then there are some other types of cancer that occur more rarely. Lung cancer is the leading cause of cancer deaths because so many people in America still smoke. Most lung cancers could be prevented because smoking is such an important cause. But we also have other irritants that are involved in lung cancer. Radon, which is a radioactive gas given off by certain types of bedrock. Not so much around South Carolina, but it was a big issue in the Northeast where I came from. And so testing for radon contamination in your home is something that is kind of something that would do regularly when you were selling and buying homes up there. Diesel fumes are another airborne irritant that have been connected to lung cancer. Asbestos is pretty serious. It has a particular type of lung cancer that it causes because the fibers of asbestos then get bind to the pleural cavity. And then just chronically having inflammation in the lungs because of whatever condition has been linked to an increased rate of lung cancer. So this, your body is inflamed all the time. It's just not happy, and cells are not working right. And so a byproduct of that can be cancer. Unfortunately, most lung cancers are discovered after they have metastasized. They're working on some early detection techniques, some tests perhaps, but right now, in general, when lung cancer is found, it has already spread. I am old enough to remember when they advertised cigarettes on television and in popular magazines. This particular magazine, though, the ad style is definitely before my time. But, when smoking first took hold in the American mindset, and especially when advertising kind of kicked off in the 20th century, we even had doctors endorsing smoking. But if you haven't seen this before, I'll show you now. This is your lungs on smoke, and this is what they're supposed to look like. So it's not smart. And then just finally to end with the effects of aging. Because we are breathing so much every day, there can be quite an accumulation of environmental influences that will affect your lung health as you age. All those airborne pollutants, slowly can start to wear away at your alveoli. And so in general, you can have just kind of like every place else, a slowing down. The cilia on the epithelial lining become less active. The mucus doesn't stay as fluid as it was. Your reflexes slow down so that it doesn't do quite such a good job in keeping the airways clear. Then, your immune system loses some of its efficiency, and so the chances of infection increases. a situation called a barrel chest may develop, which is usually a result of osteoarthritis, that basically the joints freeze in the fully expanded position. So it's like the ribs are fully open all the time. But emphysema, as people are suffering from shortness of breath and never able to have their lungs recoil the way they are supposed to because of the stiffening of the various tissues, will also be involved in causing a barrel chest to develop. The bronchial walls, certainly some of the smaller airways, may actually get to the point of collapse, which means then you have more physiological dead space, places where gas exchange cannot happen because it's no longer functioning within the lungs. So that generally as people age, even if you're not in a situation where you've got a lot of environmental not pathogens, but pollutants and such affecting your lungs, you are going to see at least a slight increase in dead space as parts of your body just get old and worn out. A brand new article that I just ran across just a couple days ago here in January says that now about 15%, and this is supposed to be a 1, boy, my typos are the pits on this one today. But 15%, 1 in 7 middle-aged, from age 40 to age 72, they looked at, older adults, suffer from some type of lung disorder. And again, many of these are connected to smoking. So that covers what I wanted to talk to you about disorders in your respiratory system. Hopefully this system feels very familiar to you, because we tend to know this one very well. This and the digestive system, I think people know a lot about, because all of these common ailments, we're sort of, personally involved. When you have an allergy or have a cold, pay attention to what's going on. So this finishes up the videos for this unit.